Over the last 2 centuries, the healthcare system has been remarkably successful in preventing many diseases and improving overall health outcomes. Life expectancy has increased and mortality rates have decreased as a result of technological advances in medicine and public health. However, the healthcare system faces unique challenges in the event of a catastrophic collapse. If only there was a way to see into the future and witness the consequences of a relatively advanced healthcare system collapsing. Well, in this case, we don't need to look any further than Lebanon. My country, Lebanon, used to have an excellent healthcare system, one of the best in the Middle East. Now both the accessibility and the quality of the healthcare system are completely failing. The economic crisis that hit Lebanon in October 2019 took lives, and the right to health was sacrificed as a result of inflation, devaluation, and fuel, food, and medicine shortages. In a collapsing country, the greatest threat to healthcare is a lack of supplies. The first wave of shortages was extremely complicated in Lebanon. In this video, I present the top 10 medicines that vanished first in Lebanon. In the pharmacies, we saw people fighting with guns over the last bottle of baby formula. I recall a friend going to every open pharmacy late at night in search of Panadol for his child. People are suffering as they attempt to bring life-saving medicines from neighboring countries such as Syria, Turkey, and Jordan. This is what my uncle is doing to ensure that his wife's chemo treatment is delivered on time. Some requested assistance in obtaining drugs from Europe or the United States from families or relatives living there, but also from unknown people that they just discovered on Lebanese social media groups. Such non-availability of drugs is, of course, a playground for scammers. At times, we may even find cancer or chronic drugs on the black market, which may be expired or counterfeit, causing severe health complications for the patients. One of the causes of shortages was the greed of merchants and suppliers who gained large profits from government subsidies. They buy the drugs with high subsidies, hide them, and then sell them later at inflated prices when the subsidies are removed. They even smuggled them into neighboring countries and freely sold them at higher prices. Many people died as a direct result of this mindset. One of the worst examples, along with others, is presented in this CNN article. After seizing an oil tanker from a smuggler, the Lebanese army was redistributing it to residents in the neighborhood. The oil tanker exploded due to a lack of security measures, killing at least 31 people and burning many more. People who had suffered severe burns were transported to hospitals. However, there was a severe shortage of burns victims' medication. Albumin, a simple but essential substance, was lacking. As a result of the shortage, people died in hospitals. Only a few weeks later, authorities discovered warehouses in Beirut full of medication such as albumin. When subsidies were removed, many medicines became available again, but their prices rose exponentially, making them prohibitively expensive for many people. Importers were unable to bring in sufficient quantities of drug, and as debts for foreign pharmaceutical companies grew, the companies refused to continue sending drugs to Lebanon. Other shortages also have an impact on the healthcare system. The shortage of medical supplies, coupled with fuel and power outages, has significantly impacted the functioning of healthcare facilities and forced hospitals to temporarily shut down machines such as dialysis machines, incubators for newborns, ventilators, infusion pumps, nebulizers, surgical kits, vital sign monitors, and oxygen tanks. Because hospitals were unable to keep operations safe, surgeries had to be cancelled. Again, saying it like this seems insignificant. However, for patients with end-stage renal disease, having fewer sessions because some dialysis machines were forced to shut down means a lower quality of life, and for others, it's a death sentence. There is no substitute for dialysis machines. The fuel shortages also impacted access to the cold chain for vaccines, as well as ambulances and patient transports to hospitals or pharmacies, particularly in small villages, forcing patients to travel to larger cities. Another shortage that has significant impact on my life is the lack of time to complete all of these free videos. So if you like them, please like and comment for the algorithm. And if you want to support me even more, you can help me on Buy Me a Coffee, YouTube, Patreon, and other platforms. The dire living conditions and economic instability in Lebanon have led to a significant exodus of healthcare professionals. This includes doctors, surgeons, nurses, therapists, and other healthcare workers, with more than 40% leaving the country. This includes all the generations, particularly those who have recently graduated. They immigrated to countries, Arab, European, or American countries, with more stable economic conditions, better living conditions, and more financially appealing offers, where the electricity bill alone does not exceed their salaries. To avoid this, the hospitals where they work offer them a percentage of their contracts in US dollars rather than the worthless Lebanese pounds, but they choose the new promising opportunities abroad. This, of course, had a significant impact on the quality of the healthcare system, with medical errors increasing as competent personnel left. It has also forced some hospital departments to permanently close because they no longer have the expertise to run them. Cancer, heart, bone, and pediatric departments, for example. The healthcare crisis in Lebanon has had a severe impact on specialized healthcare services such as dental care. Access to dental clinics has become limited, and many people cannot afford the high cost of dental treatments. Private clinics used to provide advanced treatments such as implantology, orthodontics, and cosmetic dentistry. But financial difficulties have forced the closure of some dental clinics. For other dental clinics, it was difficult for them to purchase the necessary equipment and to provide high-quality services. Dental care has become prohibitively expensive for Lebanese, and many have put off getting it for months because it's no longer regarded as essential or a priority in the midst of the crisis. Of course, children's lives are particularly affected and at risk during this collapse. Kids are malnourished as a result of skipping meals. They are also skipping basic vaccines against measles, diphtheria, pneumonia, hepatitis B, tetanus, and other infectious diseases. However, in a collapsing period with limited resources and increased health pressure, the healthcare system should prioritize vaccination as a strategy to keep the population healthy. Disease prevention is frequently both less expensive and more effective than the disease treatment. Unfortunately, in a country like Lebanon, where the state does not enforce this basic fact and where some people are unaware of it, we observed a 30% drop in immunization coverage in 2022. By the way, for people collapsing into anti-vax quackery, you went full retard. Never go full retard. Lebanon has faced additional public health challenges on top of the economic crisis. The country has had to deal with the recent pandemic, which has further strained the healthcare system and resources. Hospitals have been overwhelmed, and there has been a shortage of medical supplies, including protective equipment for healthcare workers. The recent spread of cholera due to unsanitary and poor living conditions also contributed to an increase in the demand for healthcare. I made a video here with all the learnings that I had to gain when my parents caught cholera. The devastating Beirut port explosion in August 2020 further compounded the public health challenges. The explosion caused widespread destruction, including damage to hospitals and healthcare facilities, making it even more difficult to provide essential medical services. Here is a collection of the many stories I have read, heard, or even personally experienced. I read and heard many stories about pregnant women missing their anticoagulant injections, which resulted in the loss of their fetus. Mothers are no longer seeing doctors during their pregnancies and are even having babies at home, which has resulted in an increase in the number of sick and weak newborns. I heard about a patient who became hemiplegic after missing his hypertension treatment, sepsis cases because antibiotics are impossible to find, a man who had both of his legs amputated for not taking his antidiabetic drugs, and of course, the deterioration of cancer cases due to the skipping of continuous anti-oncogenic treatments. My aunt had to take medicines for bladder disorders after a surgery. She did not find the common approved drug, but rather a substitute that was not widely used according to the literature. And despite this, she only found 4 out of 6 doses of the latter. And my aunt was considered lucky. In some cases, neither the drug nor its generic or an equivalent drug are available, which forced the doctors to prescribe a riskier alternative that may or may not help them. 80% of Lebanese are under the poverty line, and the prices of everything is increasing, so some families are forced to cut down on health expenditures. Many patients begin to raise funds by creating an online money pool in order to receive their treatments. Half of the population used to have insurance, but the minister no longer pays for medical bills. People are skipping their treatments, which result in the sudden appearance of clinical complications and an increased number of patients presenting to emergency rooms. But here is something about emergency rooms. We all heard that some hospitals refuse to admit patients unless they pay cash before entering, regardless of the urgency of the case. This has always been the case even before the crisis, but you can imagine how many patients have been left literally dying at hospital doors now. This is why in this video I try to explain how some people manage to protect their money during Lebanon's collapse despite the inflation and devaluation, because you don't want to be barred from accessing healthcare. The most unfair are those who can afford healthcare in theory, but whose money is frozen in banks and is inaccessible. At least 2 people forced their way into their banks and were successful in obtaining a portion of their frozen funds for medical treatments for their relatives. The most recent case that you might have heard about involved a girl who required funds for her sister who needed a surgery as part of her cancer treatment. She tried several times to get her money back from the bank, showing proof of the reason why, but the banks refused. So she decided to rob her own money from the bank. As I mentioned earlier in this video, the most important thing in such a collapse is to flee while you can. I am one of the lucky Lebanese who managed to flee this hellscape. And like many others, I still have a large family living there. It's simple. For me, Lebanon is only surviving because of the importance of remittances. We, the Lebanese diaspora, are helping greatly to the cost of various drugs and surgeries for our sick family members. I don't know anyone who doesn't send at least a couple of $100 every year. Furthermore, because I visit Lebanon frequently, I always bring back OTC medications in my luggage. Prescription drugs, on the other hand, are much more complicated to bring. You must find a doctor willing to write a prescription without seeing the patient, or a pharmacist willing to bend the rules a little. However, as the saying goes, God helps those who help themselves. And if you haven't already begun to help yourself and prepare for the impending collapse of your country, a la Lebanese, you should watch this video to understand why you might be burying your head in the sand. A special thanks to my Patreon and YouTube super thankers. You are the MVPs that help me continue to do these free videos.